Do the revised quality standards for chronic heart failure have implications for pharmacists? And if so, could you explain a bit?
When you look at the quality standards, usually NICE would say what the implications of this quality standards, for example, to the healthcare professionals, to the service providers, to the commissioners, and to patients. So, and it usually nicely lays out for each quality standard what it means for them. And in the healthcare professionals arena, you've got clear identification that clinical pharmacists have a role to play in actually this quality standard. In this one that I've just mentioned, it relates to medicines. It's about auditing patients who have a diagnosis of heart failure, what therapies they're on, and what they should be on. And of course, personalizing these therapies, because not everybody can be on all the four pillars, the four pillars identified in the document. And then it would be auditing that patients are on as many of the four pillars as possible, and then auditing if they are on appropriate doses that suits them, because it needs to be individualized. So this is something that pharmacists can be heavily involved in, undoubtedly, if they are within the health care professional arena, provision of the service, that is.
That's very helpful. Now, taking a wider perspective, now that the updated quality standards for chronic heart failure have been published, what would you like to see happen?
What we would like to see happening is that we take each one of those quality statements and assess how well within our each service, I mean, in each location, each ICB, each surgery, each ICS, each hospital. It's more chronic in here, so it's probably more related to primary care because this is where most patients sit. But of course, undoubtedly, if patients come through to a hospital, then no bad in actually assessing how things going with that as well. That each one of these statements is assessed and audited to see how well are we doing with the diagnosis, how are we doing in access to specialist service, how well are we doing in medications, how are we doing with our reviews, and how we doing with access to cardiac rehab. These are some things that can be checked by commissioners, by providers, and by healthcare professionals. So what we would like to see, people auditing the quality of their service against these quality standards and putting plans in place in order to enhance the provisions to meet these standards.
Now I'd like to broaden this yet further to put the quality standards into perspective. And I have two questions. The first is heart failure diagnosed at the right stage?
I think there is a role here for rethinking the diagnostic element, because we know that the diagnosis in heart failure can be improved. So we need to think more heart failure. We need to think about access to diagnostics such as a simple blood test, NT-proBNP, which, if we suspect patients with shortness of breath or symptoms which resemble what we've been talking about in heart failure, there is no harm. In fact, rather than no harm, I would say it is recommended that we don't hesitate in ordering a simple test like NT-proBNP, which will increase our chances in identifying patients who might need referral to specialist service to actually assess if they've got heart failure. The earlier we detect heart failure, the better. We are likely to catch it early on. We've got enough therapies at the moment which can cut down mortality and improve quality of life. We're very lucky in having a lot of pharmacological therapies, but also non-pharmacological options such as devices, which can change the life of many people out there who are diagnosed with heart failure. The earlier we catch and diagnose the condition, the better. The quicker we intervene, the more we give people better quality of life and we reduce mortality. So that's a really important area to focus on.
That's useful. And my second question is there a role for cardiac rehab in chronic heart failure?
We need to invest more. We're a little bit more familiar with cardiac rehab post heart attack, post MIs. But I think the cardiac rehab for patients with heart failure is got a significant importance and benefit. And it's something that we ought to focus on and work with commissioners and service providers in order to enhance the provision for it. Definitely. It's an area that it's not as good as we want it to be. And the more we can invest in it, the better. Definitely.
Dr. Rani Khatib, thank you very much for sharing your insights into the updated quality standards for chronic heart failure. That really has been most interesting. For more information about Dr. Khatib's work, please visit our website using the link in the description, and be sure to sign up for more news, videos and journals. For updates straight to your inbox, please follow the link below. And thanks for watching.